Hey, I'm Robin Robertson. People have been asking me about my knee, and so I thought I'd just do a quick video to tell my 8-surgery knee story. The first knee surgery I had was when I was 13, and that was because I had a condition called discoid meniscus. So the technology at the time was to open up the whole knee and take out the entire cartilage on the lateral side of my knee. So that one was the first part of my knee surgery down there. And the second knee surgery I had was when I was in college, because it hurt so badly they needed to go in there and check it out. And so that was done with an arthroscopy with 3 holes here. At that time my doctor told me that my knee looked like it was about 85, and if I wanted to walk when I was 30, I needed to stop doing all impact sports. And being a skier and a competitive runner, that was a big life-changing moment for me. But I did, and I started cycling, so that was a really good thing. Opened amazing doors for me. And then actually when I was 35, I could hardly walk around the block, so I was too young for a knee replacement, and they did a surgery called an osteotomy, where my femur was cut about here, and my leg was realigned because I had become very knock-kneed. And so they took some bone out of my hip, straightened out here, and I was on crutches for 3 months afterwards, no weight bearing, which was a challenge when my kids were 2 and 4 years old. So that's 3 knee surgeries. Then I had 2 other surgeries on this knee. I also had a discoid meniscus on that side, but with the new technology they just trimmed out the bit that shouldn't be there, and then cleaned up a few other bits on one of the surgeries. And then the other couple of surgeries, so that's getting up to 5 surgeries, 8 total. I had 3 other surgeries on this knee. This nice scar in the center is not a knee replacement. That's a typical scar for knee replacement, but a doctor had to get over to this side to clean up some of the arthritis. And I still have bone growing in places that it shouldn't be. That's a part of arthritis. So he said it could save me a scar by opening up in the middle, since I eventually would have a knee replacement. And so he did that, cleaned it up, and I've had a couple of tune-ups in there every once in a while. There's some bones growing in places that inhibit movement in my knee. I don't have a big range of motion, but I still have enough to get around the pedal stroke, and that's the most important thing for me because I can still cycle. So that is my knee story. Thanks.